Good evening. My name is Tina, and I want to talk a little bit tonight about one of the topics that I find very essential is cultural sensitivity, cultural awareness. I have recently worked in tribal facilities, and it is one of the things that I have been able to really expand on learning about is traditional native practices within treatment facilities, which really includes a lot of the things such as spirituality. Now, I have a master's degree in psychology where I really was able to focus on transpersonal psychology, which really brings in the spirituality into healing and wellness, which is one of the things that I have the opportunity to do when I'm working with a native population in a native facility. So, absolutely appreciate that. They're able to, in such a facility, we are able to really embrace traditional practices, embrace traditional providers. Maybe that's a spiritual provider. Maybe it's using the practice of sweat lodges or sage, or like cleansing the room with sage and sweetgrass and things like that. That's one of the things that's real important to me, that people have a clear understanding of who they're working with. This kind of brings me to person and environment. In the population that I've worked with, person and environment really is able to identify where the client is, what is the environment the client is living in, how is this environment affecting this client, is it in a positive environment, is it a passive where maybe their support system will support them or maybe not support them, or is it in maybe a clean and sober situation where they're really working towards working with a sober support system and following through with maybe a 12-step program. I'll refer to some of these things because what I do professionally is a substance use disorder professional clinical director. So really that's my scope, and that's my lens to be able to review some of the things and the clients that come through and how we are able to work with them. Another couple of things that I would really like to touch base on would be self-care. Self-care is essential in this field. I have been in the field for 20 years, and it is absolutely essential to have a plan, to have self-care, or you're going to burn out. You really starting with boundaries, professional boundaries, really making sure that you are there to assist the client in developing their treatment plan. Not that you are taking on the whole process, your whole self, trying to figure out their whole life. That's not our goal. Our goal is to find out what is most important for them. How can we provide the resources for them? Where can we support them in moving forward? So, just one of the things that really jumps out for me. Another one, okay, let me expand on the self-care a little bit more. And possibly some self-disclosure. The self-care doesn't really come in the form of, say, yes, I do self-care. But what does that really mean? And I think that really is also one thing that you can explore with your supervisor. Talk to your supervisor about your self-care. What does that look like? Be real upfront about things and let people know maybe you need to take a mental health day if you're working and just take a break. Maybe that's it, but you just need to be aware of that. And I think these are the things that really jump out for me. And I want to thank you for listening to my thoughts about this week, and have a great week. All right, thank you so much. Bye.